Hi, my name is Patricia Luz and I am going to talk about the COVID-19 pandemic and the incident of acute myocardial infarction. Definition: COVID-19 is an infection disease caused by a recently discovered coronavirus, EIM, obstruction of the blood supply to the heart muscle. This video below is for you to understand something about the COVID-19.
Coronaviruses are a large family of viruses that get their name from the halo of spike proteins on their outer surface, which resemble a crown, the corona, under a microscope. The new coronavirus is called SARS-CoV-2. SARS-CoV-2 stands for Severe Acute Respiratory Syndrome Coronavirus 2. As a new virus, it means that previously no one in the world has been infected with it, and
Application in medicine. There are multiple situations that have been identified as triggers of EIM in the previous hour or days. Expected higher incidence of EIM triggered by acute stress of fear or COVID-19. The EIM.
Acute myocardial infarction is acute closure of the coronary artery, which is related to either rupture of the plaque, leading to acute onset of thrombus formation and sudden arrest of blood supply to that area, which is defined as ST elevation myocardial infarction. You may not have chest pain in certain conditions. Majority of the time you will have chest pain, but there are certain variables like advanced age, diabetes, they may not have chest pain.
Pros and cons. The incidence is reduced with the decrease in work stress, habit, and psychosocial factors. The patients do not want to go to the hospital for fear of getting COVID-19. Do not consult to avoid using doctors or calling ambulance that may have to respond to the needs of the pandemic. Important steps to prevent COVID-19.
The virus that causes coronavirus disease is spreading in some of our communities. This disease, also known as COVID-19, is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs or sneezes. These droplets can spread to the mouth, nose, or hands of people who are nearby, or possibly be inhaled into the lungs. Take steps to lower your risk of getting sick. Here are some things you should do. Wash your hands often with soap and water for at least 20 seconds. You can also use hand sanitizer that contains at least 60% alcohol. Take extra measures to put distance between yourself and others. Avoid close contact with people who are sick. Stay home if you're sick, except to get medical care. If you have severe symptoms, please.
And others. Insure athlete in Ecuador. Acute myocardial infarction is the lead cause of death in adults. 20% of people admitted with coronavirus suffered heart damage. The mortality of the EIM that arrive at the hospital and receive treatment in the first 6 hours in less than 8%. The relationship between COVID-19 and EIM.
Hello friends, in this video I will discuss about coronary artery disease and its approach in COVID-19 patients. Among all patients who are diagnosed with COVID-19, various studies shows different incidence of coronary artery disease ranging from 4.2% to more than 25%. Coronavirus directly or indirectly affects cardiovascular system. The potential mechanisms may be direct injury from hemodynamic dearrangement, injury due to hypoxemia, inflammatory myocarditis, stress cardiomyopathy, thrombosis due to hypercoagulable state, or systemic inflammation. Clinical impact and mortality has been found greater in those with prior cardiac disease. Before going to management, we have to know how acute coronary artery syndrome is defined. The term ACS, that is acute coronary syndrome, is applied to patients in whom there is suspicion or confirmation of myocardial injury. ACS patients either have ST segment elevation myocardial infarction or non-ST elevation ACS.
Conclusion. The coronavirus affects more elderly people who are at risk of a higher proportion of EIM due to exposure to stress, generating great oxygen demand and endothelium dysfunction, increasing the risk of mortality. This video is for everyone to understand that they must take the necessary measures. Thank you.